How do doctors find the seizure focus before epilepsy surgery? Imagine trying to fix a tiny leak in a complex plumbing system. You need to find exactly where the water is escaping before you can repair it. That's similar to what doctors do when they try to locate the seizure focus in the brain before surgery. Knowing exactly where seizures start helps ensure the surgery is effective and safe. The process begins with a detailed review of the patient's seizure history and neurological exam. Doctors look at when seizures happen, what symptoms they cause, and how they progress. This initial step gives clues about which part of the brain might be involved. Next, they use advanced imaging techniques. Magnetic resonance imaging scans are like detailed maps of the brain's structure. They can reveal abnormalities such as scars, tumors, or lesions that might be causing seizures. Sometimes, functional MRI scans are used to see which parts of the brain are active during specific tasks, helping to avoid important areas responsible for speech or movement during surgery. Magnetoencephalography is another helpful tool. It records tiny magnetic fields generated by brain activity, helping doctors locate abnormal electrical discharges linked to seizures. When MRI scans don't show clear abnormalities, MEG can provide additional clues by overlaying electrical activity onto detailed brain images. Electroencephalography, or EEG, is a common non-invasive test that records electrical signals from the scalp. It can detect abnormal patterns that suggest where seizures originate. However, scalp EEG sometimes lacks precision, especially if seizures start deep inside the brain. That's when more invasive techniques come into play. Stereo-electroencephalography involves implanting tiny electrodes directly into the brain tissue to record electrical activity from inside the brain. This method provides real-time, high-precision data about seizure onset. Intracranial EEG, similar to sEEG, involves placing electrodes on the brain surface during surgery for even more detailed mapping. Recent technological advances have introduced computational methods. Machine learning algorithms analyze complex EEG data to distinguish epileptic areas from normal brain regions more accurately. These tools help doctors make better decisions about where to target treatment. Once the seizure focus is identified, minimally invasive options like MRI-guided laser ablation can be used to destroy the abnormal tissue precisely. Focused radiation or thermal energy can also be applied to treat well-defined seizure zones without open surgery. In summary, doctors use a step-by-step approach that combines clinical evaluation, advanced imaging, invasive recordings, and cutting-edge computer analysis. This thorough process ensures they locate the seizure focus as accurately as possible. Precise localization is vital because epilepsy surgery works best when seizures originate from a single, clearly defined area. Every patient is unique, and these methods help tailor treatments to individual needs, increasing the chances of seizure control while reducing risks. If you or someone you know is considering epilepsy surgery, it's essential to work closely with a specialized medical team to determine the best approach based on personal medical history and diagnostic results. Always consult healthcare professionals for personalized advice and treatment options.